I'm turning 47 in a few months, which means in 3 short years, I'll be celebrating my 50th birthday. As women, the changes that we go through in our premenopausal, perimenopausal, and postmenopausal phases in life can be very disheartening and confusing, especially when we don't understand what's going on, why changes are happening so fast, and what we can do to counteract it. Looks are by no means the most important thing in life, but the changes that we go through with our appearance and our bodies can have a dramatic effect on our overall confidence and our psyche. In last week's video, we discussed all things estrogen cream for the face. So if you missed that video, be sure to watch it. In today's video, as promised, I'm going to shed some light on the changes that our skin and our faces and our bodies are going through during this time period and things that we can do to help reverse these changes, especially when they're happening at a very rapid pace. I'll give you some tips on how to gracefully maintain your youth as you go through these changes while still looking like yourself. We'll also discuss some important health precautions and preventative measures to take as you go through these later decades in life. First, a quick disclaimer. Dermatology is my area of expertise. I'm a board-certified dermatologist who spent extra years in training in cosmetic and procedural dermatology. The advice and information that we share online is based on my years of school and in training, mastering my subspecialty of medicine in cosmetic dermatology. It's also based on things that I've learned from my own research and encounter with my own providers and my personal experience. Every woman should follow up with her doctor because each individual woman is so different, and I cannot emphasize that enough, especially on social media when there are these blanket statements, clickbait education, fear-mongering. What fits one woman may not fit another. Even with your best friend or your sister or your mother or your daughter, what works for one woman may not work for you. As a physician, but also as a patient, I can shed light on my personal experiences because people always ask me about hormones that I take and my personal experience, which I'm happy to share with you. But what works for me and my body may not work for you. So again, although I'm a physician, this is not medical advice. We're just sharing information to help others that are going through a similar situation. Also, for you guys to share comments and stories and your experiences in the comment section so that other women can benefit from your knowledge and your journey and your experiences as well. Have a provider who you trust, shop around, get second and third opinions, and once you find a provider who you vibe with, it's really important to have your labs checked and to go through this journey with someone who sees eye to eye with you on what your journey looks like and the things that you're experiencing that is customized to your individual body type and your physiologic profile. Okay, wrapping aging post-menopause. This is a real thing, you guys. I see it in my office every day. I see women saying, I don't know what's happening in the last couple months, sometimes even weeks. People say, I woke up, I have these wrinkles under my eyes, my face feels like it's falling off, I have this laxity, I don't look like myself, I look old overnight. And it happens a lot, you guys. So don't be scared. Don't be afraid of it. I feel like sharing our experiences is empowering and educational and can help guide us with making decisions on what may be best for us to maintain our youthful look, or even just not even a youthful look, maintain the way that we looked before. So first, what happens to our bodies and faces through menopause? Well, in our face, we have a lot of structural changes. I see women every day in my office. I see hundreds of patients each week. I've seen people go through menopause and the perimenopausal phases in their life. And although I started practicing close to 20 years ago, I remember being a younger provider and watching these women go through it. And now that I'm older, I'm 47 now, I feel like I'm right there with you guys going through this with you. And it can be very disheartening. It could really break a woman's confidence, not only with her husband or with her kids or with her friends or her family, but just with herself looking in the mirror. It's hard. The changes are hard for women in different phases of their life. It even is hard when you're trying to become pregnant or when you are pregnant or when you're postpartum after having a baby, when you're entering menopause, when you're going through menopause, after menopause. Women are always in this constant flux where our bodies are changing, our hormones are always in flux. It affects your overall appearance and fat distribution in the body, the way you feel, the way you encounter your husband, your significant other, your kids, your friends, yourself. As a cosmetic dermatologist, I'm treating the whole patient, not just their skin or what they look like, but I really make a conscious decision to be empathetic with what my patients are going through. The women who are going through postmenopausal changes, it's very hard. You can see clinically the structural changes that their faces are going through. Now, what are some of the changes that happen? The skin thins, the extracellular matrix proteins, the collagen, the elastin, the glycans, which are the sugars that provide a structural support in the skin, start to diminish. So what happens is not only do you not have that smooth, bouncy, tight, firm contour, but you start to get wrinkled and lax and the skin thins and it crepes and folds on itself. Pores get stretched out. If you had acne scars when you're younger, they become more accentuated. Also, the wear and tear and shearing forces on the skin, because you're losing that collagen and elastin, it makes you more susceptible to injury or traumatization. If you bang the back of your hand on a chair, you're going to get a bruise where you didn't get that 20 years ago, because all those extracellular matrix proteins, the collagen, the elastin, and all those structural proteins diminish. And not only does that give you wrinkles and fine lines, but it makes your skin not as strong to withstand shearing forces, and you get blood vessel fragility, which causes extravasation of blood, which I hear myself becoming more scientific, so I'm going to water it down. Basically, you bump your hand and you get a bruise. You go from having smooth, tight skin to having wrinkled skin, but it's from the same mechanism of action. It's from the diminished density of collagen and elastin in your skin. So what we can do is enhance your body's own regenerative processes to restore all those extracellular matrix proteins. Now, that could be in-office procedures, that could be things that you do at home using certain skincare products, different habitual lifestyle changes that you can make. So we'll go into that in a little bit more depth throughout this video. So for all my menopausal beauties out there, I'm making this video for you. And whoever you follow on YouTube, you want to make sure that these people are actually seeing patients day in and day out. I make these videos once a week for you because I love to do it, but my main job is being a clinician in the office, seeing hundreds of patients, and I see women going through these phases of life, and we're trying to do in-office procedures to gain their confidence back, to restore the collagen that's been lost through estrogen depletion syndrome, which a lot of people refer to as EDS, but be careful because that could also be a dermatologic term for Ehlers-Danlos syndrome. But we see these changes, and this video is for you guys. I made it because I see so many women in the office, and I actually do these procedures on women in the office, and you guys are my girls. You're my women, you're my patient population, you're my tribe, you're my family, and this is why I'm doing this for you. If you look at another YouTuber and you look at their Instagram and they're just talking head images and no images of them actually seeing and treating patients, you know, I'm coming from a different vantage point because I spend most of my time in the clinic doing in-office procedures on my beauties, trying to restore the collagen that's been lost or offset the changes that are happening in estrogen depletion syndrome during the perimenopausal and postmenopausal phases in life for these beautiful women. How do women's faces change during menopause? Now, we've talked about the skin and the loss of the proteins that give skin that beautiful, youthful, bouncy structural support, but it's more than just skin deep, right? So you have your subcutaneous fat pads, the adipose tissue, the fat pads that shrink and separate and change in a woman's face also get affected during the estrogen drop and the drop in hormones that happens in the menopause phase of life. You also get bone resorption. A lot of my beauties will have jowling in the pre-jowl sulcus, laxity when they put their head down. They do this, like, doctor, I don't like my angle when I'm FaceTiming my kids and I can see this gathering of skin here. You lose that jawbone support and you no longer have that structural support that holds up the pre-jowl sulcus and that jowly loose skin area of the face. In addition, you start to get orbital aperture enlargement and peaking of the medial orbital rim. So what that means in English is the orbit, the globe, like where the eye sits inside the skull, opens and widens and thins. So our eyes get sunken. We start to get that sunken, hollowed look as well. You start to see sometimes a little apex in the medial part of your eye. The fat pads are separating and sometimes herniating to cause the tear trough. So you get a bunched up fat pad right here juxtaposed to a volume depletion, or you can get festoons in the mid face because your fat pads are moving and migrating and thinning out. There's so many different changes that happen, not just with the skin, but the subcutaneous tissues, the bone resorption, the actual cranium and the skull bone itself changing over time. If you look at a woman's skull in their 30s, 40s, 50s, 60s, and beyond, there's definitely orbital and bony structural changes that happen even in the bone. And then that makes sense because that's correlates with what we see clinically. Also, the SMAS, the ligaments, the muscles start to hang, gravity takes its toll, and everything starts moving south with gravity. So there are certain in-office procedures that we can do that are going to help manage the skin envelope and make the skin look its best, but it can only go so far. Sometimes you have to go to procedures that are outside, just non-surgical, because it's just more than the skin envelope. It's, you know, restoration of the bones and the ligaments and moving facial fat pads and fat transfer and reattaching muscles. And that's not in the scope of my practice or this YouTube channel, but I want to include that so we're all inclusive when we're talking about different procedures that can offset the transitional changes that happen and the structural changes that happen as a woman goes through menopause. Other things that happen is with the elongation and the gravity pulling down on the face, you get an elongation of the upper lip, the cutaneous lip, which is the distance between the nose and the upper lip. It lengthens with time. So that's why like Ellacor or lip lift surgery or tightening devices or CO2 can shrink that space to give it a more youthful look by pulling up on the upper lip and shortening that length. A lot of people will make the mistake of coming in and wanting a lip line filler, but you have to be very strategic as an injector. And believe me, I've been doing injecting for almost 20 years. I used to sneak out of my medical student lectures and go into the derm residence clinic and do like lip injections because I was so enthralled with cosmetic dermatology. I've been doing this a long time. One of the most important techniques as an injector to learn how to do is when a woman comes in and wants lip filler or they want lip lines softened, you combine it with lasers and tightening device. You don't just plump up with a bunch of filler because that can actually elongate the distance between the nose and the upper lip. Botox can too. So lip flip or right-tid Botox, you have to be very careful with where you're placing those injections because you don't want to elongate the distance between the nose and the upper lip. In addition, you start to get relaxation of the platysmal band in the neck. Now don't look at my neck because I just did skin beef yesterday for tech necklines. Hopefully I'm not too bruised. But what happens is you get platysmal bands and Botox can help retract those muscles back to make it look more smooth and you stop getting that ill-defined jawline neck junction. So Botox in this area by a skilled injector can definitely help snatch that back. There's so many different in-office procedures we can do to help stimulate collagen and restore those changes that are happening during estrogen depletion syndrome or menopause. So lasers, tightening devices, injectables, biostimulatory fillers, biostimulatory procedures. There's so many more and we'll talk about these in upcoming videos as well. We've talked about the skin and the structural changes that happen in our faces. What about our bodies? Fat distribution with hormonal fluctuations is a real thing and a lot of people will get fat in an area that they didn't have it before. Now, I love doing deoxycholic acid, also known as Kybella for body contouring. I do it on myself. And those areas that have stubborn fat, no matter how much you diet or exercise, it just won't go away. Usually like in the midsection, the bra fat, back fat. A lot of women come in with increased fat over their knees, which is probably like my number 2 place for body contouring for women day in and day out in my clinic. The fat distribution changes as we go through hormonal changes. And the body wants to hold on to fat as a survival mechanism in certain areas, and it will not get rid of it no matter how much you diet or exercise because it is just that, a survival mechanism. So doing things like Kybella, cool sculpting is not my favorite. Liposuction is not my favorite either unless there's a large amount of adipose tissue that needs to be removed because you could have paradoxical fat hypertrophy, which means you get fat in somewhere else, or you can have textural irregularities or scarring or ill-defined contour after liposuction. So for those really small, stubborn fat areas, I love injecting Kybella there because it's always smooth, it always looks natural, and knock on wood, but there's never hardly any complication except for maybe some bruising sometimes and a little bit of pain. When it's done correctly, I can't emphasize that enough. How the skin changes through menopause. We already talked about the structural support of proteins, how they get diminished, but also the cells, the cellular proliferation rate, the keratinocyte maturation phases in the skin. I spent years looking at cells under the microscope. I did Mohs micrographic surgery. I was a skin cancer surgeon, and I would look at people's skin through different phases in their life, and you can histologically see changes in the cells with hormonal changes and estrogen depletion. For example, during menopause, the cells are smaller, they're more senescent, sometimes they're referred to as zombie cells. They stop producing collagen and elastin as much as like a child or an adolescent would. You start to see everything slowing down. So doing procedures and in-office procedures are going to stimulate the skin cells to act and behave younger, give rise to clinically more youthful, more beautiful looking skin. Also, if you take a skin biopsy of someone who is pregnant, their melanocytes, which are the pigment-producing cells in the skin, are all revved up. During pregnancy, your melanocytes are so revved up and overproducing melanin. That's why you get melasma. That's why you get the linea nigra. That's why you can get darkening of your nipples and you get, new moles or darkening of existing moles. It's profound, the effects that hormones have on the skin cells. And in menopause, you can see the decreased production of collagen and elastin, and the cells are smaller and they're not as active and they're sticking around longer. They don't have this rapid cellular proliferation rate where they're renewing themselves, giving beautiful, healthy, glowing skin. Someone asked me recently, why when you're pregnant is your skin so beautiful, but then you also get melasma? All the cells are revved up. There's growth factors, there's hormones. It's a pro-mitogenic, meaning increased cell renewal hormone. So skin cells are revved up. So with the melasma and the acne is going to come beautiful skin that's supple and hydrated and full of collagen and looking beautiful if you can see through the acne and the melasma. But what I'm saying is skin cells have a very profound response to hormonal fluctuations in the body. So it's important to take that into consideration and just keep in mind that what you're seeing clinically, what does that look like under the microscope? And I always keep that in mind when I'm analyzing a patient. How old is she? What phases is she going through in her life? Is she going through IVF? Did she just have a baby? Is she going through menopause? Did menopause happen 10 years ago? It's really important to understand cellular behavior, and when you understand it at that level, it's really rewarding to pick out products or procedures that are going to help that individual woman. Hormone replacement. This is a very controversial topic that usually as a physician I try to avoid because each individual woman is different, and what works for one woman may not work for another. The benefit of hormone replacement therapy comes with risk, and each woman should follow up with their provider, get their labs checked. I think get your labs checked every 6 months, not just once a year. For myself, I'm on the low estrogen pill. I have to get off my pill, let my body re-equilibrate, and have my labs drawn to see where I'm at. Now, I actually haven't reached my perimenopausal era in life yet. I'm not sure how, but I've been on the birth control pill since I was 18. I'm 46 now. This is just my story and my information. I'm not recommending the hormonal replacement therapy or birth control pill. I'm just sharing my experience with you. I've been on the pill my entire life, and every once in a while I get off of it and I let my body readjust, and then I have my labs drawn. Now, there's a huge array of different hormones in the body. You have estrogen, progesterone, and testosterone, and they easily get converted to one another in the body. Bioidentical hormones, what does that even mean? If you think about a hormone like estrogen as being a key, and you have the hormone receptor being a lock, a bioidentical hormone, what that means is it's not estrogen that's the key, but it's another duplicate key that looks like estrogen and can still open the lock. The key's slightly different, but it still opens the same lock. It still activates the receptor that has a signal transduction cascade downstream that's going to have a certain effect, whether it's beautiful, healthy skin, mood, hot flashes, libido, whatever, it's going to have this downstream effect. So bioidentical hormones are taken and systemically absorbed either through an oral route or a transdermal patch, an injection, a pellet. There's several different ways of getting the hormones into the body. And sometimes it's a different array of hormones. Sometimes it's one hormone, sometimes it's multiple hormones. A woman should follow up with a provider to see if she is a candidate for hormone replacement therapy or bioidenticals and which hormone or hormone ratios would be best for her. People say in the comment section they want these blanket white and black statements like all women need estrogen or women need progesterone and estrogen or nobody should do hormone replacement therapy. It's so all over the board, you guys. And again, each patient is unique and should be catered to their individual phenotype and profile. So hormone replacement therapy has a lot of benefits, but also comes with risk. It can be risky for cardiovascular disease, diabetes, certain types of cancers, increased coagulopathies like blood clot formation and so forth. And the data is so all over the place and it's so contradictory. I don't even feel like I can even talk about this in this video, but what I can say is I remember when I was in my 20s and I was a medical student myself, my body did really well with being on the birth control pill. When I was 18 years old and I was in college, I went to the student health center because I had really bad periods and they started me on estrogen birth control pill. And the only 2 times in my entire life I've ever been off it was to get pregnant with both pregnancies, stopped the pill, got pregnant, had a baby, breastfed, got back on the pill. And my second baby, stopped the pill, got pregnant, had the baby, breastfed for 18 months, then I got back on the pill. And I'm still on it at age 46. Now, my women's doctor and me have decided for me to stay on that. That is my personal journey. My body does great with it. I don't have any issues with my mood. My skin looks great. I don't really feel any of the effects of perimenopause right now. Now, that's me. I know that other women have horrific experiences with the pill. Some people can't tolerate the IUDs. Some people can't. So you just have to find what fits right for you. But I remember being a medical student, I was in my early 20s, and I had to make a conscious decision. Well, if I'm going to be on this birth control pill, my body likes it, I feel good on it, and this is what I'm accustomed to, I may be at increased risk for breast cancer. I have a family history of breast cancer. My mom actually had breast cancer when I was in medical school, which was horrible and devastating, and we got through it, but I have a family history of breast cancer. My breast cancer risk is actually 38%. Now, I'm followed very closely by a woman's physician. I get a breast MRI and mammogram every 6 months. I actually do the Preventative full body scan. I take it very seriously, and I do self-breast exams every day. So I know that that's a risk for me, but when I was in my 20s and I decided to stay on the pill, because after being on my OBGYN rotation, I remember thinking, well, gosh, it could possibly increase my risk of breast cancer, which it can. can. But it also was known to decrease cervical cancer, endometrial cancer, ovarian cancer, and cancers that aren't as easy to detect and screen. So I figured breast cancer was easier for me to detect and I could follow closely, and other forms of cancer may be decreased, and there is a cardiovascular risk. You do have an increased risk of clots. I'm not a smoker. I'm not even around smoke. So you have to just weigh the pros and the cons of each individual treatment and make an informed decision for yourself after talking to your provider. I also want to take a minute to talk about hormone replacement therapy and its effects on the skin. So when there's estrogen depletion in the skin, it's not as simple as last week's video when we were talking about estrogen cream. It's not like you take a estrogen cream that was engineered to be applied topically to the vaginal mucosa and apply it to your face, and it will undo the effects from estrogen depletion in the skin. The reason why that doesn't work, and the body is highly complex and a very dynamic system, is that you may not have the estrogen receptors on the skin on the face. So if you put an estrogen cream that was engineered to be on the vaginal mucosa on your skin, even if it's a different type of topical estrogen, it may not have the receptors to bind and uptake the estrogen. Also, it can have some of the counteracting effects like melasma, hyperpigmentation, and acne. In addition, when you have estrogen depletion in your body, and I see this from my patients who I see in my office who are going through menopause, their skin is depleted. You can tell their collagen is depleted, their elastin is depleted, their skin is falling, and you see a physiologic clinical phenotype of that manifestation that's happening. But putting a cream on isn't going to really reverse those, because it's an endocrine, it's a systemic, it's an endogenous estrogen that is being depleted, not just something that is 1% of it is absorbed through the skin. I guess what I'm trying to say is when you have estrogen levels in your body drop and the effects it take on the skin, it is not as simple as just putting on a cream that's going to reverse it. Sometimes replacing it from within the body is what's needed to offset the changes that you're having from endogenous or through the body or systemic estrogen loss. So just keep that in mind when talking about bioidentical hormones or hormone replacement therapy, and then weigh that with the risks that it may come with as well. Okay, estrogen's effect on collagen. Collagen gets produced less, and the synthesis of collagen greatly decreases as estrogen and hormones level decrease in the skin. And that's what causes that lackluster dullness and wrinkled laxity that we see in the skin. So things like lasers and skincare products that contain retinol or vitamin C or AHAs or activators that are going to increase collagen synthesis can help offset some of those changes that we're seeing with estrogen levels declining and their effects on collagen. Okay, estrogen creams for the face, refer to last week's video. And again, estrogen creams are probably not going to provide the same amount of collagen stimulation that some things that we already know work can do, like a tretinoin or active ingredients that have vehicle delivery systems that go directly and bind the fibroblast cells, which are the collagen producing cells in the skin, to upregulate collagen synthesis. It may not have the effects that like a resurfacing laser, either ablative or non-ablative or a combination of ablative and non-ablative, may have on the skin, or like a chemical peel. But it's good to just be informed and to make an educated decision on what would be best to help reverse these changes that you're seeing in your skin as we go through this phase in life. Tretinoin for menopause. I feel as a dermatologist that tretinoin is one of the most impactful active ingredients that we can put on our skin. And if someone can't tolerate a tretinoin, which is retinoic acid, retinol is a very impactful vitamin A derivative that can have profound, enormous impacts on the skin. Now, of course, like anything else, you want next level vehicle delivery systems so that the vitamin A is actually getting to where it needs to go in the skin and having the effect that you want it to have in the skin, because many topical products these days are either white labeled or they're not using next level technology. Some of them are the same formulations that they were 10 years ago. And there's been so many advances in the industry to make these skincare products work more effectively and give dramatic before and after results within days or even weeks of use. And that is also what motivated me to start my own skincare line. I knew exactly what the skin cells needed, how to get them there, how to keep them stable, and how to get these next level real life results that I see in my office every day. So MDR skincare routine for menopause. Definitely you want something that's going to upregulate collagen synthesis, increase cellular renewal, increase the extracellular matrix proteins, especially like under our eyes, in the crepey thin skin, that's going to upregulate our skin cells to act and behave younger, to counteract the depletion of estrogen that is no longer stimulating the cells to work in these cascades. So it's really important to just do do your research, and make sure, you guys, that you're not getting your skincare products that are white labeled by someone who really doesn't understand the skin. They're just trying to use fancy marketing and make money. And make sure that you are noticing results within days or weeks of use of your products. If you're using a new skincare product and you're like, I'm not sure if it's working, you want to know for sure. Your friends, your significant other, your husband, your best friend should be like, what did you just do? How does your skin look so beautiful? How is it glowing like that? I could spot someone using MDR skincare a second by the time I walk through the door in my clinic and I see the patient sitting there with this beautiful, flawless skin without the need for makeup. There's a look, there's a result. And if you're not getting those results, it's time to switch to a skincare product that you can use that are going to give you these results. In addition, in-office procedures definitely help as well, but they may not be affordable or accessible to everyone. So just get a good skincare product, even if it's just one. And if it's not in your ballpark to get medical grade skincare with advanced technology, then get something just even at the drugstore. Invest in a good sunscreen. Use Adapalene by Differin or Rock Retinol or whatever you can do or afford or get your hands on to combat the loss of collagen and the loss of estrogen effects that you're seeing in your skin, because doing something is better than not doing anything at all. Anti-aging strategies for menopause. Intermittent fasting has been gaining a lot of popularity, and the promotion of autophagy has been getting a lot of attention on social media lately. And I honestly have to say, as a physician and a provider, I do believe in the power of autophagy and intermittent fasting. It may not be for everyone. I actually practice intermittent fasting, but I encourage you guys to look it up, because autophagy and intermittent fasting can help mitigate some of the effects that we have as our estrogen levels decrease and our hormone levels change through menopause. NMN and other anti-aging supplements may be beneficial in menopause. NMN has gotten a lot of attention recently in mitigating some of the postmenopausal, perimenopausal, and premenopausal symptoms, including hot flashes, mood swings, inability to sleep, and many other side effects that we see with menopause. So look into that. There's other anti-aging supplements that could be beneficial, not only for the menopause, but also for the estrogen depletion effects in our skin. And I recommend that you refer to my supplements video to take a look at that. Other supplements include ginseng, St. John's wort, flaxseed. There's so many different supplements out there too that could provide a healthy alternative to offsetting some of the side effects from menopause without having to resort to hormone replacement therapy if that's not an option for you. Does Botox and filler work after menopause? And the answer is absolutely yes. First of all, Botox, which is a neuromodulator and affects the synapse-snare complex in the pre- and postsynaptic membranes of nerve cells. What that means is it decreases the muscle's ability to contract, and that does not have any effect on menopause at all. It can be affected by certain other things with how much you work out, if you're building a resistance to the neuromodulator. There's other things that can come into whether someone is or is not sensitive or becoming resistant to a neuromodulator, including Botox. But filler, as a cosmetic dermatologist, I'm actually more of a laser specialist and energy-based device girl, but I do, think that filler does have its role. I myself has avoided fillers now in my older age as compared to when I was in my 20s and 30s, but I do feel that filler does play a role in combination with other therapies. For example, if someone's having bone resorption with menopause and they're losing their mandibular structural support right here, doing a little bit of Volux or a jawline filler to provide that structural support to lift up on the little gathering that you get down here may be beneficial. And yes, absolutely, postmenopausal women are very sensitive to Botox and filler, and also energy-based devices and lasers. I had a beautiful 75-year-old woman in the office just last week, and she was like, well, doctor, I don't even know if I should do thermage because I'm not going to be sensitive to it. Your skin is like a muscle. It's an organ system just like the musculoskeletal system. It responds to stimulus. So if you go to the gym and you lift heavy weights, your muscle is going to grow. If you are in the office and your fibroblasts are stimulated by the heat from energy-based radio frequency like a thermage, it's going to produce collagen. Now, it may not produce as much collagen as someone who's 20, but it will absolutely produce collagen. And the melting point of the collagen that gets synthesized is lower, so that subsequent treatments you'll be more responsive to. So not only are my more mature beauties who are postmenopausal responsive to lasers and energy-based devices and fillers and Botox, they are even more responsive to subsequent treatments once they start getting conditioned, once their skin gets conditioned to the in-office procedures. It's really amazing to see. I posted not too long ago a woman who was in her 70s and she hadn't had any treatment. She did one thermage treatment and she looked amazing. She had an amazing before and after, and that's in her 70s, not really doing much of anything else. So absolutely, yes, you can still stimulate collagen after menopause. Do lasers work after menopause? Absolutely, yes. I do it every day. I do it every week. I see it all the time, and these women do phenomenally phenomenally well and have beautiful, vibrant, glowing skin without the need for fillers or injectables. They just have their collagen stimulated, and they have their own regenerative process in their skin that has fallen asleep and become senescent, get reactivated and start producing a bunch of collagen to smooth, tighten, and lift the skin. And they look and feel amazing and beautiful and confident in their postmenopausal years. And it just brings me such joy to be able to do that for people. These treatments are in-office procedures that wake up the skin cells that have fallen asleep or become senescent because of estrogen depletion. It's just basically working out for your skin. It doesn't have to be some big dramatic, fully ablative CO2 or erbium laser. It could be a clear and brilliant, or it could be a Fraxel Restore, or it could be a halo, or even a very light CO2. All these lasers have different settings that you can accustom and accommodate the skin to really not have that much downtime, but just to have amazing results. And once you start getting in the rhythm of doing it once a year or twice a year, many people just come in after the summer to reverse the sun damage that they occurred during the summer months. It really can have a profound effect on the collagen stimulation ability of your skin. Remember, the best way to make skin look and behave its best is to, on a cellular level, stimulate it to naturally do what it was genetically inclined to do in the first place. Make collagen, make elastin, make all those extracellular matrix proteins, stimulate cellular renewal. That's what the skin does when you're younger. And as you get older and your hormones start to drop and the stimulus to the cells start to drop and diminish, then the cells become sluggish and sleepy and slow, and they're not as good at doing their job anymore. So you have to do laser resurfacing. You have to do energy-based devices. You have to use skincare products that activate them, stimulate them, let them be stimulated to act and behave younger. And that's when people have flawless, beautiful skin. Yes, I do neuromodulators and fillers in my office too, but it's honestly not my favorite thing to do in my postmenopausal beauties. Those beauties respond best to tightening devices, lasers, resurfacing, and things that are going to refresh the skin and make them have the most perfect skin envelope for that phase in their life. You won't need to wear makeup. You won't have to worry about the brown spots. You won't have to worry about the textural irregularities. It also decreases the risk of skin cancer and precancerous lesions. Healthy skin is beautiful skin. So things that are going to make the skin healthy, reverse sun damage, stimulate the skin cells to act and behave younger, that gives beautiful, flawless, glowing skin. And I see it every day. Is a facelift the only answer? And the answer is no. I really think it's important as a dermatologist to manage expectations. There's only so much I can do as a cosmetic dermatologist doing non-invasive, non-surgical procedures. I can optimize the skin envelope. I can make the skin look tight, firm, smooth, erase brown spots, shrink pore size, help smooth out fine lines and wrinkles and acne scars. But there's nothing in my power, in my scope of practice as a dermatologist that I could do that's going to move around fat, resuspend musculoskeletal SMAS, ligaments, bone, cartilage. My treatments are only skin deep, and they can do a lot, but it's important for me to manage expectations. If a person really is doing this thing and they really just want to have a face or neck lift result, then I definitely defer to my plastic surgeons colleagues, and that's really important to just manage expectations. I have some women who will have a facelift at age 40. And then I have some women who are in their mid-60s and rocking it. Some of my most beautiful patients are in their 60s and beyond and have never had surgery. And they look amazing. And they do lasers and they use medical grade skincare. And they still live a life in the sun, but they wear their sunscreen and they live a healthy lifestyle. They eat clean, they drink lots of water, and they still are out having a blast, but they really hone in on the importance of stimulating your skin cells to act and behave younger. So again, a facelift is going to give a result that is beyond anything that I can do non-surgically as a dermatologist, but those non-surgical interventions can do a lot with maintaining the skin envelope. I just can't do anything to, redistribute the fat or resuspend cartilage or ligaments, but then I defer to my plastic surgeon colleagues for those types of results when needed. But I would say more than half of my patients don't want to go under the knife. They don't want surgery. They don't want to put themselves at risk for some of the complications that can happen with surgery. For those people, energy-based devices and lasers are a really great option. And even for some people who want to have a facelift, doing laser resurfacing and stimulating the collagen and the elastin is a really important adjuvant to surgery. So it's not like one or the other. It's not like if you're going to have a facelift, you could just thrash your skin and let it go and not worry about what it looks like, because then it's like you're tightening old battered upholstery on a new chair. Even if you have a lift, tuck, pull, facelift and neck lift, and if you have like brown spots on your skin, there's like a disconnect and it looks weird. When the eyes scan the face, the brain perceives things as like weird, normal, old, old, young, sick, healthy. And when someone has a face and neck lift, but they're not taking care of their skin, it looks off, you guys. So even for my beauties who do have surgery, taking care of your skin is very, very important. And I think a lot of plastic surgeons are coming around and appreciating dermatology and trying to get into the skin space also, because they're realizing that their facelift result patients look way better when their skin is optimized. So my team and I were contemplating dedicated an entire video to facelifts. Would you guys like to see a video on my opinion and how to find a good surgeon for a face and neck lift? Because again, this is beyond my scope of practice, but I could provide insight as a provider who sees a lot of patients, many of them who have or have not had face and neck lifts. And if you guys want us to dedicate a video on this topic, just be sure to drop a comment in the comment section what you want to hear about. Next, I want to talk about women's health and the importance of preventative medicine. Just a month ago, I underwent, my first full body scan with Preventative. It's basically an MRI that you can do, and it's a full body scan, and it looks at everything. I mean, everything. I want to talk about how important it is to check your labs, which I've already talked about in this video, but also invest in doing a full body scan if possible, or having your preventative medicine scanned, your mammograms, colonoscopy, pelvic exams, everything that comes with being a woman. It's really important, and I can't emphasize enough how much prevention is key as we enter our later decades. I'm not sponsored with any of my content, but Preventative is a full body MRI scan, and it scans for everything. Baby little aneurysms that later on can give you trouble, colon polyps. Of course, it does not replace visiting with your provider and having your preventative scans like a colonoscopy, mammogram, pap smear. But I think it's a really great thing to do to know where you stand and what your body is like, and know maybe what things need a little bit more investigation. If you need to get an x-ray or a CT scan of a certain thing that they find on this full body scan. Knowledge is power, and your body is sacred and is the one vehicle you have for your entire life, and it's got to last a long time. So know it well. Be preventative, be proactive, and not go overkill and make yourself a hypochondriac, but just make sure that you're getting your body scans and all your preventative measures and scans and exams and tests accordingly. You guys think I'm obsessed with my skin. You should see how I'm obsessed with my health. I've been doing this since I was 21 years old because I was always interested in health and the human body and medicine. So I've really stayed on top of it. So for those of you who are at risk for various types of cancers, genetic testing, full body scans, and then also all the preventative screening tests depending on your age, whether that's a pap smear, mammogram, colonoscopy, all the things. Just stay on top of your health. Skin is important, and skin's my area of expertise, but your whole body health is of the utmost importance. So how I plan to stay young while I go through these changes. And I mentioned this earlier in this video, but I've been on the low estrogen birth control pill since I was 18 years old in college. It just works well for me and my body. I had a really hard time with my periods when I was younger, with cramps and all the things, but my body does really well on that pill. So my female doctor and myself have decided to keep me on that pill, and she also said that that might be contributing to the way my skin looks now in my mid to late 40s. So of course, yes, I do all the things. I do lasers, I do energy-based devices, and I started at a very early age because my co-residents and I were basically giving each other unintentional anti-aging treatments by practicing lasers on each other. I would always Fraxel under my eyes. I don't know how many times I've done that, but it really has proven to be beneficial now in my later years. I am going to probably stay on this birth control pill, which is an oral estrogen. It's a low dose estrogen, but she said that she wants me to be on this until my early 50s, and then we'll reevaluate my hormone levels and maybe change me onto something different. But my body does well with that, and I'm taking the preventative measures to stay on top of risks like breast cancer. And when I'm on a long flight, I'm always up and walking around and trying to contract my muscles to prevent blood clots, and I stay away from anyone who smokes, and I try to live the healthiest lifestyle as possible. My approach to my journey through menopause and perimenopause, I've had my levels checked when I was off the pill just temporarily to see where I'm at, and I'm not really entering that stage yet, but when I do, I'm going to still keep doing the things that I do. Lasers a couple times a year. I do a Fraxel at least once a year. I Fraxel under my eyes 2 or 3 times a year. I do a thermage every 5 years to my under eyes and my lower face. I use my MDR skincare products, and I know that that has the most advanced vehicle delivery systems, active ingredients, and I don't have to worry worry about it because I engineered it myself and I know what's good. I know what needs to go into those products, and I made those products for myself and for my patients. I stay up with that, and then I live the healthiest lifestyle as possible. Now, as you can see, I live on the beach. I'm going to take my son surfing right now. I'm still outside and in the sun and enjoying my life, but I'm smart about it. As I go through these phases in my life, I will probably stay on my pill and stay on top of my collagen boosting and skin enhancing treatments in the office and by what I do at home with respect to the skincare actives that I use and photo protection and protecting my skin. So that's that. Now, in some of my previous videos, I'll get a lot of comments saying like, okay, you're 46, just wait until you're 50, wait until menopause hits, we'll see when it happens to you, haha, or you look like this now, but just wait until you hit menopause and then it's all gonna be over. Like, I'm here for it, and I am well aware that I'm 46, I'm not 55, but I will get there someday, and that's okay. Every year of life is a blessing and should be celebrated. Every year around the sun is something to be happy about, and just because you're getting older doesn't mean that you can't counteract some of the changes that we're going through, whether that's hitting the gym and lifting more, or eating cleaner, or doing more Fraxel, or doing more collagen boosting in office procedures. So my take on it is I welcome it. I'm here for it. I'm here for turning 50 and going through menopause. I'm down to do it. And I think that it's not as scary of a process if you understand that these changes are going to happen to each individual differently, and knowing why these changes are happening and having it make sense. You're like, that makes sense. My hormones are fluctuating and my estrogen's dropping, and now I'm in this weird phase where they're up and down. Standing and understanding the pathophysiology behind the changes that we experience in our skin, the way we look, our mood, weight changes and fluctuations, just being knowledgeable and understanding what's happening and how to mitigate it in a healthy way, I think is everything. And so for those of you who are commenting, just wait till you reach menopause and you look good now, but you're gonna look like shit in like 2 years, like that's fine, and I welcome it, and I know I'll go through these changes, and I'm gonna take you guys with me and show you what I do. And it probably won't be that different from what I'm doing now, but I probably will have to up my game a little bit. So I just wanna remind you guys that we're all in this together, and I see you and I hear you, those people that are saying, okay, wait till you go through menopause, Capel, we'll see what's gonna happen to you, and I'm here for it. Bring it, I'm ready. And on that note, you guys, thank you so much for watching. I do these videos for you. I love to do it. I try to find time in my schedule when I'm not seeing patients and not with my kiddos to make them for you, but the feedback that I get back from you and the positive responses and comments make it worth it for me, and I just thank you so much for your support. All right, have a good weekend.